Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Tlea, Senior Managing Editor of Practical Dermatology magazine. Skinder, a dermatologist-developed app, may help medical students learn to spot skin cancer. Skinder works like the matchmaking app Tinder, but instead of considering pictures of potential dates, swiping right if they're attractive or left if they're not, users consider high-resolution pictures of lesions, swiping right if they're benign or left if they're cancerous. As users categorize each lesion, the app tells them if they're right or wrong. At the end of the session, the app scores their overall accuracy. Dr. Michael Kolodny, who chairs West Virginia University's Department of Dermatology, developed the app to cultivate intuition in medical students sooner, and an initial study suggests Skinder may improve how accurately medical students diagnose melanomas. The study's findings appear in JAMA Dermatology. 36 West Virginia University medical students participated in Dr. Kolodny's study of the app. None of them had completed a dermatology rotation yet. During the study, half of the participants spent an hour reviewing the ABCD rule for identifying melanomas. The other half of the participants spent an hour using the app to rapidly browse through images of lesions and categorize them as malignant or benign, based solely on their appearance and without formally applying the ABCD rule. When the medical students took a follow-up test to see how well they could visually diagnose melanomas, participants who used Skinder scored significantly better than their counterparts who focused on the ABCD rule. Dermatologists make their diagnoses based on just looking at a lesion and seeing what comes to mind. The reason medical students can't do that is they have very limited exposure to dermatology, says Dr. Kolodny in a news release. The idea behind the app was to expose them to thousands of images in a short amount of time to develop this intuitive sense. Dr. Kolodny thinks the premise of Skinder could be useful in other fields that rely on visual diagnosis, such as radiology and ophthalmology. Eventually, he wants to expand Skinder's photo library and make the app available for free download. That way, more medical students and even dermatology patients can use it. Stigmatizing views and myths about psoriasis are pervasive among the general population and medical students in the United States, according to research from the Perelman School of Medicine at the University of Pennsylvania. The findings are published in the Journal of the American Academy of Dermatology. The study also found false perceptions about psoriasis continue to persist, including the belief that psoriasis is contagious and that it is not a serious illness. Although it's widely recognized that the appearance of psoriasis can negatively impact patients' social, professional, and intimate relationships, we wanted to quantify the perceptions patients with psoriasis face on a daily basis in order to understand how pervasive they are, says the study's senior author, Dr. Joel Gelfand, a professor of dermatology and epidemiology at Penn, in a news release. Rebecca Pearl, PhD, an assistant professor of psychology in psychiatry, was the lead author of the study. Researchers used Amazon Mechanical Turk, or MTurk, a web-based data collection service, to survey people about their perceptions of individuals with psoriasis. They also sent the survey directly to several hundred medical students. In all, 198 laypeople responded on MTurk, and 187 medical students completed the emailed survey. All participants were shown images of people with psoriasis as well as close-up photos of psoriasis lesions. Overall, 54% of laypeople who responded said they did not want to date someone with psoriasis. 39% said they did not want to shake hands with someone suffering from the disease, while 32% said they did not want to have someone with psoriasis in their homes. Respondents also endorsed several stereotypes about people with psoriasis, with 57% saying they were insecure, 53% saying they were sick, 45% saying they were unattractive, and 27% saying they were contagious. Medical students demonstrated less stigmatizing views compared to the MTurk group. Among MTurk participants, those who knew someone with psoriasis or had heard of psoriasis demonstrated less stigmatizing attitudes. It's possible that better education about the disease, as well as contact with individuals with psoriasis, may help to dispel myths and stereotypes and reduce negative perceptions, Dr. Pearl says. The researchers stressed the need for further research with larger sample size before drawing any definitive conclusions. However, they said the findings do have implications for both public health and patient care. Future studies should evaluate the effects of education campaigns on people's attitudes toward those with psoriasis, as well as efforts to incorporate patients with psoriasis into general medical education for physicians and other healthcare providers, Dr. Gelfand says. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.